Hey, Mr. Senior.
Hi.
Hey, my name is Brittany. I'll be your nurse today, and I'll be doing your physical assessment. I already checked the doctor's orders, and he did order a head-to-toe physical assessment. Is that okay to do?
Yes.
Can you verify your name and date of birth for me?
Matthew Sinyard. Date of birth is 01/25/1989.
Okay, so January.
January 25th.
Okay, alrighty. And I'm going to perform hand hygiene and give you privacy. Can I double check that on your wristband? Can I touch your wrist?
Yes.
Alright, perfect. So I am going to start off with just the head. I'm going to go ahead and palpate it to make sure there's no lesions or anything else. That looks good. Head is symmetrical with the rest of the body. Eyes are symmetrical with the nose and the ears on the face. Ears are symmetrical with the face as well with the eyes. Grooming looks good. I'm going to check for JVD if you'll look that way. No jugular vein distension noted. No jugular vein distension noted bilaterally. I'm going to go ahead and check your ears. Is that okay?
Yes.
Okay. Okay. Ears look good. No drainage. No redness noted. Ears color on the inside matches the rest of the body. Do you mind if I look in your nose? Have you had any ear problems lately, like ringing in your ears or pain?
No.
What about in your nose? Any nasal drainage, anything like that?
Yes.
Yes. Okay. Are you having any today?
No, not today.
Okay, so I didn't notice any. No nasal drainage noted today. Have you ever had a deviated septum or nasal surgery?
No.
Okay. I'm gonna go ahead and check in your mouth. Can you say ah and stick out your tongue? Okay. I see a small spot on the tongue. It looks like it might be a small burn. Did you burn yourself on a piece of pizza today?
Yes.
Okay. Oral mucosa looks nice, light pink and moist. No lesions noted there. I'm going to go ahead and check your eyesight. I want you to look at the TV in front of you, and then when I say look, I want you to look at this pen, okay?
Okay.
Okay, look down. Okay. And I want you to stare at the TV again. I'm going to assess Perla right now. I'm going to look at your pupil dilation, okay? Okay, pupils dilated appropriately bilaterally, and I would say pupil size is a 5. Okay, alrighty. Have you had any eye issues lately, like eye pain or an infection?
No.
Do you wear contact lenses or glasses?
Yes.
Okay. Alrighty, so I'm going to go ahead and ask you a couple of subjective questions about your consciousness. Do you know where you're at?
Yes.
Where are you?
In a hospital room
Okay. Alrighty, why are you here?
for a checkup.
Okay. Do you know what day it is? What month?
Yes. September 30th.
Do you know who the president is?
Joe Biden.
Okay, alrighty. So consciousness seems to be good, no issues there. I'm going to go ahead and start with your cardiac auscultation. One more question. Have you been having any issues remembering things lately?
No.
Okay. And have you been having any headaches lately?
No.
Okay, good. All right. So I'm going to go ahead and listen to your heart. So you can just breathe normal. This is the aortic, pulmonic, Erb's point, tricuspid, and mitral. And we also listen for S3 and S4 with mitral to note any murmurs. No murmurs noted. Have you been having any heart issues lately, like high blood pressure, anything like that?
No. Slightly high blood pressure.
Okay, but you're going to see your doctor regularly about that.
Yes, I
Do you
am.
have a monitor at home where you can check your blood
Yes, I
pressure?
do.
And you have a book that you're writing it down in?
Yes, I do.
Alright, while you're there, I'm going to go ahead and assess your lungs. Have you been having any coughing lately? You mentioned drainage recently.
Just a slight cough.
Okay, and if you do have anything that you feel like is in your lungs, you need to get it out. I do recommend turning your head, deep breathing, and coughing to get that up. Also recommend an incentive spirometer 10 times an hour, okay?
Okay.
Alright, let me listen to your lungs. Every time I put my stethoscope on you, I want you to deep breathe, okay?
Okay.
Alright, so this is the right side of the lung. The right side has 3 lobes. You have your upper lobe, your middle lobe, and your lower lobe. Your middle lobe cannot be seen on the posterior of the, or cannot be heard on the posterior of the back. Your left lung only has 2 lobes, the upper and the lower. So I'm going to start my auscultation on the right side, right upper. Okay, if you don't mind sitting up for me and just crossing your hand and touching your shoulder. Alright. Okay. Okay. No adventitious sounds noted bilaterally in all 3 of the lobes on the right side and both lobes on the left. Did we already discuss any issues breathing lately? Have you had any issues breathing?
No.
You don't have a history of asthma or anything like that?
No.
Are you a smoker?
No.
Okay, good. Alright, so next I'm going to, oh, I forgot one thing. I'm not sure, hang on, excuse me, I apologize. Okay, so while we're here, I'm going to go ahead and do your abdominal area, let's do one more thing with your nose. I do want you to hold one side of your nostril and breathe out and in, and do the other side as well. Okay, do you have any issues there? The
No.
left side a little bit, or?
The right side was a little stopped up.
Alright, so a little bit of congestion. Alright, now I'm going to go ahead and do your abdominal area, your GI. Have you had a bowel movement today, or when was your last bowel movement?
This morning.
Okay, and have you had any abdominal issues, cramping, diarrhea, nausea, vomiting?
No.
Okay, a history of any stomach pain, stomach cramps, stomach surgeries?
No.
If you don't mind laying flat for me, I'm going to go ahead and assess for it. Just for the video, I'm not going to pull his shirt up, but I would pull the patient's shirt up to note for any distension. So no distension noted. I know that he has, his umbilicals is in, so that would be an inversion with an I. I'm not going to palpate first because that could mess up my auscultation. I'm going to start my auscultation in the lower right quadrant and work in a clockwise motion. You just breathe normal. Okay, There were bowel sounds, but it was hypoactive. Now I'm going to listen for any bruit or whooshing. This is the abdominal aorta. Okay, no bruit or whooshing sound noted. Alright, you can sit back up for me. Okay, so now I'm going to do some range of motion exercises. We are going to start, let's just start with your elbow. I'm going to have you flex and extend. So I'm going to use my non-dominant hand, and I'm going to have you turn palm up, and I want you to extend it, and then I want you to flex it. Okay, and then I'm going to do resistance, push against me. Okay, and then try to push against me. Okay, all right. No crepitus noted, and I would do both. So we're going to do no crepitus noted bilaterally. I'm going to do, let's do your wrist. We're going to do an extension, and then we're going to do a hyperextension, and then we're going to come back and we flex and everything. Okay, so I'm going to use my non-dominant hand. So I want you to flex, and you're going to hyperextend it, and you're going to flex and extend. Okay. Alright, so no crepitus noted. I would do that bilaterally. And then we're going to do the same for your knee. So I'm going to use my non-dominant hand. So I want you to flex and extend. So flex it and extend. Okay. And then I forgot to do your wrist with the resistance. Let's do that real quick, and I'll go back to your knee. So I want you to push against. Okay. Okay. All right. And then I'm going to do let's do, if you'll put your feet this way. Let's do the flex and extend again. So extend and flex. All right. And I want you to push against me. Okay. Push against me. Okay. Good. No crepitus noted. I would do that bilaterally. Everything looks good. If you'll swing your legs back, we're going to do your ankle. You're also going to hyperextend as well. All right. So I want you to flex and extend, and then try to hyperextend a little bit. Okay. No crepitus noted. I would do that on both. And now I'm going to do resistance. Okay. Resistance is good. If you don't mind standing up real quick, just for the sake of the video, I'm going to have you do your gait and balance. So I just want you to walk this way and then walk back. And then for your balance, when you walk back, I want you to put one foot in front of the other. Okay, gait and balance both look good. Okay, you can sit back down. All right, I'm going to go ahead and check for capillary refill in your fingers and your toes. Capillary refill is less than a second. For the sake of the video, I'm not going to do both, but I would in a normal physical do both. I'm going to note capillary refill less than a second bilaterally. We'll do your toes. Capillary refill less than a second bilaterally. Again, I would do both feet. All right, I'm going to check for edema. Okay. I would do both. No edema noted. No edema noted. Alrighty, have you been having any joint pain lately?
No.
Any issues with any parts of your joints, fingers, toes, arthritis?
No.
Okay, we're going to go ahead and rate any pain you may have. Have you been having any pain in anything?
No.
Okay, so on a scale of 1 to 10, what is your pain today?
0.
Okay, good. I'm going to just check my notes and make sure I've performed everything. I do need to inspect your grooming. Your hair looks good, everything looks groomed well, patient looks like he has good hygiene. Three risk factors if this patient was, say, immobile in the bed, then 3 risk factors would be that he would need to be turned every so often. There would be an issue with possibly urination and his bowels. We would need to make sure he either was changed and perineal care performed, and then he could even develop like a pressure ulcer in his heels or in his buttocks. I'm going to go ahead and also check your skin turgor to make sure you're not dehydrated. I'm just going to pinch this. Okay, skin turgor looks good. Earlier when I checked your ears, I did say you had any ringing in your ears and you said no, right?
Correct.
Okay. I am going to ask you to slightly look up and swallow for me. Okay, trachea looks midline. Patient is able to swallow, so he is not at risk for aspiration. The Glasgow Coma Scale, that is just a scale that we assess when patients are coming out of comas to see where they are at. I already assessed your consciousness and your orientation. If you were to cough and you had any sputum, I would assess the color and the odor and the consistency of that. I did forget to check your pulses. We do have several pulses in the body. You have your carotid on either side. You would not assess these at the same time because the patient could pass out. You have your brachial artery, your axillary artery, your femoral, your popliteal. I am going to assess your radial. Okay, it's 2+. Your dorsalis pedis feels about a 1+, and then your posterior tib. This one. 2+. I apologize, I forgot after I did your GI inspection to palpate, so if you don't mind scooting back down, I am going to palpate. The reason we palpate the abdominal area is also, we noted for distension, but that can also help to look for distension, and it can also see if there's any masses. So you use the 4 pads of your fingers on one hand, and you press down about 1 centimeter. Am I hurting you? Okay, no masses noted, everything looked good, and patient was not involuntary guarding. Patient was not guarding at all. Are you passing gas?
No.
During the day? Normally?
No.
No? You're not passing gas normally?
Sometimes.
Okay. Alright. We did range of motion and strength. I assessed gait and balance. It looks like we are completely done. So I appreciate your time, Mr. Senior, and I will have the doctor come in to do your assessment, okay?
All right.
Thank you.